How do you treat a second smile? So if you're anything like me, you might be picturing this, but it's not like that. It's actually a little bit more subtle. It's like this. And this line upsets a minority of patients. Most of the lines that our patients complain about are vertical lip lines, but there are a minority of patients who get a horizontal lip line. This lip crease troubles some of them, whereas others actually find it quite endearing and they like that particular line. Our job as clinicians is to try and identify who will benefit from a treatment and who will not, and make sure we get the best result, both psychosocially as well as aesthetically. So in this episode, we're going to discuss this line in depth. We want to know who we should treat, who we shouldn't treat, how to treat it, and why it can be quite tricky to get a good result on some patients. Let's now consider the anatomy that's driving the formation of this crease. The key thing to understand is that it is caused by the muscles around the nose and the upper lip. And I think this is actually quite variable between different patients. So for example, sometimes in some patients, it will be caused predominantly by the action of the depressor septi muscle and its connections in that area of the face. In other patients, it may be the orbicularis, and I think the levator labii lecnasi plays a role in some patients. And then in many patients, it can be any of the lip elevators. I think this is particularly true when a nose is quite strong. You'll often notice a stronger nose with good lip elevation, and you're very likely to develop a crease, which means all the lip elevators may be playing a role. So it can be zygomaticus major, minor, levator labii muscle, the levator labii lecnasi muscle, and the depressor septi muscle could all be contributing to the formation of this crease. And you can see how this could be very difficult to treat because you cannot neutralize all of those muscles. So in terms of who to treat, we're actually looking for patients who are, just like in many of our treatments, somewhere in the middle of the spectrum. If you've got a very powerful lip elevation and a strong nose, you're unlikely to be able to stop that with Botox and dermal filler. However, if it is milder and the crease is smaller and the muscles involved tend to be a little bit on the weaker side, but still enough to cause a crease, you've got more of a chance of improving the situation. So I have an example here. Layla happens to have an upper lip crease, and she was very interested when I said that this might be a problem for some people because she's actually always liked the crease. And this is very important to notice because removing something that a patient likes is never a good thing to do as a clinician. I would actually never treat Layla's upper lip line crease until she becomes bothered by it, if she does, when she's much older. In the short term, we can use her face to understand the anatomy of what is driving this particular issue. So Layla, can you do a big smile as if I said my usual hilarious joke? Okay. Have a look at what's happening as she's smiling. We've got obviously action of zygomaticus major, levator labii lecnasi. We've treated gummy smile in the past, which is probably, it is slightly softer than it was once. Do you think it's still working? I think it's still working. So in particular, I see this pulling up here, and then there's a rotation here and a very small formation of a crease. And this is caused, I would say, largely by the more medial lip elevators rather than zygomaticus major. But you will see some patients with a bigger nose and usually a broader smile where they're pulling up a lot laterally, and they also get a crease that's probably harder to treat. You probably could, if you really wanted to, soften it further with increasing the amount of toxin we've used in levator labii muscle, I would guess. And it might work doing similar injections to a lip flip. You just basically slightly neutralize some of this muscle which is curling up the lip. Because if you have a look, a lot of what's happening here, we've got levator labii, which often curls round. It affects the nostril, but also curls into the lip. So it's actually pulling the surface here. But you also have, I think in some people, this action of this medial muscles that pulls the surface of the lip up. So you can imagine the downside of treating this crease might also be that she actually has less upper lip show. And I think that's actually what you like about it, is that your lip rolls upwards. So as you smile, your lips get bigger. Mm-hmm. And that would be the downside of completely stopping this, is if this no longer contracts and rotates upwards, yes, you get rid of the crease, but you also lose the show of the top lip. So that could be a really good reason not to treat this crease. So how do we treat this problem? You can treat this in multiple different ways and with different modalities. Like any crease in the face, it's a combination of what is happening to the tissue and the effects of the muscle on the tissue. So often we would think first to treat the muscles causing it. So how can we relax muscles in certain parts of the face without disharmonizing the face? So we want to create a beautiful smile without the distraction of the line, if that's what the patient perceives. Now this can be done with very small amounts of botulinum toxin, but it can also be done in some patients with dermal filler. Dermal filler acts like a mechanical block of the muscle. As you add volume, the muscle has to contract harder against dermal filler. And this is a common way that you can treat a gummy smile. In fact, in many cases, I find it a little bit more easy to create a harmonious smile because mechanical blockage is a little bit gentler, and it's particularly useful when the patient already has some volume loss. So if you have a patient with a horizontal lip crease, a nasolabial fold, and volume loss generally, you should definitely be considering some dermal filler in the picture. And this can start with nasolabial folds that decrease the lip elevator's activity. You can also do this with botulinum toxin, of course. And then you can also strengthen the lip with dermal filler. Now, it's worth remembering that if you volumize a lip, this actually has the opposite effect. And you'll often see young girls, unfortunately, who've been overtreated, who develop new creases because of the impact of having a large amount of dermal filler right next to tissue that hasn't got any additional strength involved. So a strong lip rises up and compresses tissue above, and they develop an upper lip line crease, or even more commonly, the vertical crease that makes them look like a duck, where you get a crease here where the cheek meets with the upper lip. And that's caused by a similar effect, which is you have a large amount of product next to an area that hasn't been treated, creating a new focus for weakness. So we need to do the opposite of that. For example, we can treat the philtral columns in some patients. So the columns are usually what becomes disrupted by this crease. As the lip rises up, the tissue bends and the philtral columns are dissected by the crease. So you can get some benefit from directly treating the philtral columns. Of course, this filler is not massively powerful, and it works better to do this in conjunction with other treatments, but it can soften the crease in some patients. This is a better course of action in most people than directly filling the crease. So if you directly treat the horizontal line with filler, this can create various disharmonies which we don't want. The most important of which is you start to make the white lip compete with the pink lip. So you now have a projecting white lip next to a relatively smaller pink lip. It simply doesn't look natural. You can do it a little bit. Tiny amounts of a low viscosity product might soften the line just enough in some patients, but you really have to rein yourself in from trying too hard, or you will alter the shape and create that kind of Homer Simpson shape, which we are often trying to avoid when treating upper lip lines. Overall, I would make sure you select your patients carefully, choose those with smaller lines, and be completely honest with those with deep lines, strong noses, and big elevators that it's going to be very hard to soften this line. If you enjoyed that and you like learning more about anatomy, make sure you sign up to my waitlist. We've got something really cool coming if you want to really master this topic.